Good day, everyone. Well, welcome, everyone. We'll welcome you officially to Building Effective Harassment Prevention Systems. Um, this is our last webinar of our series for 2025. And so, again, we're just so honored that you've joined us today, and hopefully in this conversation that Sheen and I will have together, just unpacking some of this, we're hoping that you will walk away with some net new, as well as maybe some things to think about. And the goal is we're never going to be perfect, but we can always be that 1% better tomorrow than we were today. And now more than ever, it's certainly a really great time to highlight not only the need for, but also talk about, what are some of the structures, what are some of those frameworks that can really help us build more effective harassment prevention systems, because these are so critical for us as we build a high-performing, high-thriving, highly innovative teams. And I'm assuming because you're here that you're hopefully interested in doing that, and hopefully we can help share, and this can be a great group share. So that said, without further ado, I do want to jump in. So why don't we do some introductions? And Sheena, put it right to you to go first, if that's okay.
Thank you. I appreciate it. My name is Sheena Prasad. I use she, her pronouns. I'm the senior consultant here at Diversio. I do all kinds of things. I come of linguistics and discourse studies as well as cross-cultural communication. And I'm really excited to be here with you all today. Go ahead, Mateo.
Cheers. Yeah. And my name's Mateo. My pronouns are he, him. I'm the Senior Inclusive Leadership Facilitator with Diversio. Bit of my background here. I spent the majority of my career in healthcare. I have my clinical specialties in internal medicine and emergency medicine. That said, I work with leaders all across Canada, the US, the UK, and EU. I've also taught academically both here in Canada, the US, and taught first year medicine at Waseda University in Tokyo, Japan. So that's a little bit about me. And if people feel very comfortable and open and vulnerable, please share with us what you do, the organization you're with, and where you might be zooming in from. I always love to know like who's who in the zoo when people are sharing. So feel free again, and you can certainly do that in the chat. But just a few things in terms of the different interactive features. If you need captioning, there should be a show captions button. I just want to highlight there. There is the chat, and we're encouraging folks, please, yeah, we'd love to get engagement in the chat as well too. Sometimes the chat, can get quite, I think what the kids call lit. It gets busy. And if you have a specific question you want to ask, if you put it in the Q&A, that will just make sure that that's there. And we will make sure that we have enough time at the end and also throughout the session to answer questions that you might have as well. So that said, Sheena, do you want to take us a quick through the agenda?
Oh, yeah,
Sorry.
absolutely.
Yeah.
So we're going to be starting by talking about kind of why we brought this up. There are some game-changing requirements that have just come forward, especially within kind of Nova Scotia legislation. So we're going to be talking about that, as well as implications kind of on a broader national scale in Canada. Then we're going to move on to policy regarding workplace harassment, failures versus success stories. We have a little bit of a case study and why compliance does not equal prevention. We're going to be moving on as well to an interactive red flag audit that Mateo is going to lead. So you can start to think a little bit more about your current approach that you're using at your workplace and try to assess it in real time. Then we're going to be bringing forward a 90-day implementation playbook. So afterwards, you're going to be have access to a toolkit. So we're going to walk you through how you can implement a safe system, an effective system over the course of 90 days. Mateo is going to also present a case study of what this looks like effectively in real life. And then we'll have time for a Q&A as well. So of course, drop your questions in the chat, drop your questions in the Q&A, but we'll have some time at the end to go through it as well.
Excellent. Thank you. And so to get us started, I'd like to do some live polling. If you've been to any of our sessions or webinars, you know that we love live polling. What I love about it is it allows for folks with different levels of comfort in their participation to be able to participate, especially for folks that might need either more time to process or might not feel as comfortable, sharing in the chat. And I want to hold space for that. And I love this. I use it at the university all the time. What I love about it is completely anonymous. And just allows for different ways of engaging. So different ways to get there. You can scan this massive QR code on your phone, and that will take you to the first question, or you can go to polev.com/Mateo, and I'll just go to the very first question. And I'll just move the QR code to the upper right-hand corner. But just how you feeling today? How you feeling coming into today's session? We just got a very simple 5-point Likert scale, asking how you're doing. So I'm seeing some responses coming in now, some greens. One of the things I'll just share too, this is one of many ways I like just to, finding different ways to be able to check in with the team, check in how they're doing. Because, if you ask folks verbally, often you get, the response that they think that you want versus maybe how they're truly feeling. And always trying to find different ways to really do a pulse check with your folks and with your team. So thank you. So we've got about 7 responses coming in. It looks like, this morning folks are in the either lighter or darker green. So thank you for that. I really appreciate this. And keep your live polling up, or keep that close by, because when we get to our red flag audit, we'll revisit some live polling, and we'll be asking these questions throughout. So why don't we unpack a little bit about, the sort of the why. For those who don't know, even if you're not, and I see some folks from my end of Turtle Island here as well in the chat. But even if you're not part of Nova Scotia or don't have operations in Nova Scotia, it's really interesting what's happening there. And we're going to, talk more specifically in just a bit about this. But for those who don't know, as of September 1st of this year, the government in Nova Scotia is requiring employers there that now are legally required under the Occupational Health and Safety Act to establish, implement, and maintain a workplace harassment prevention policy. And they're the first jurisdiction in present-day Canada that really is taking it to the next level. And we'll talk more specifically, but what's interesting is when we look at, what they're doing. Sheena, this is something both you and I have been, well before September 1st, 2025, have been really, I don't want to say screaming, but have been saying we need to move beyond just that performative, or beyond just doing what is keeping us just the bare minimum legal compliance if we truly want to set the table for a high-performing, high-thriving, highly innovative team, because of the impact that harassment has in eroding employee engagement, eroding psychological safety, eroding the ability of that team to truly thrive. And it's interesting, when we'll unpack this in just a second, but these new requirements that are been brought out by and rolling out by Nova Scotia aren't just compliance. They are very much a cultural shift. And for those folks that are, operate in Nova Scotia or have operations in Nova Scotia, it's a game changer for them. And what I like about this is really around, when I say like, not that I like that the fact that they have to do this, but the like that is really connecting the rising cost of psychological injury claims to organizational accountability, and just really invites this reflection to really thinking about what would a harassment-free workplace look and feel like in your own organization. And I'd love to unpack that further. But like I said, let's move the boat forward. And I'd like to get into another live polling question. So if you had that, if you're using your phone, or you can, open up a new tab on your computer. And if you need the QR code, it's in the upper right-hand corner. I can make that a little bit bigger for you if you need it. But the question is, how confident are you that your current policy prevents harassment rather than just responds to it? And so we're seeing some folks saying poor, some saying fair. What I'm not seeing yet is anyone saying, yes, it is. I am very confident. And so maybe there is some opportunity, for us to discuss some more specifics. And as we do this, I'm going to pass back to Sheena, just to really talk about, the why, that lived reality that folks are experiencing.
Yeah, absolutely. Thank you, Mateo. I'll ask you to click through so that I can talk a little bit about the excellent circumstances and what some of you might be experiencing in your workplace. But look at some sources from Stats Canada, specifically the 2020 survey on sexual misconduct at work. And we see that 47% of women have indicated that they have experienced harassment or sexual assault at work. This is a huge number. This is a reality for a lot of people, myself included. I have experienced this at work. Unfortunately, you might have as well. But also, I think it's important to remember that the behavior spectrum around harassment is really broad, right? Many incidents are non physical, things like teasing, like off-color comments, joking, verbal harassment. These are a lot more common than like outright assaults, but they are still a part of the experience of harassment. As well as like as we're looking at these statistics, it's important to think about reporting, and that's what we're going to talk about today, safe reporting mechanisms. A lot of incidents are not recorded or acted upon. I myself have experienced harassment and I've not said anything to anyone about it because I wasn't sure that anything would be done about it. So the statistics that we're looking at are often only reflective of what is reported or what is surveyed, and it's not the full prevalence of what might actually be happening in real life. Wanted to talk to you a little bit about intersectionality as well. If you're unfamiliar with the term, it's how our identities combine with each other to affect our experiences in the real world. We know that vulnerability increases with intersectionality. So women, people with disabilities, 2S LGBTQIA plus individuals, racialized individuals, and Indigenous individuals often report higher rates of harassment. We see this in the data.
Thank you. And I just want to add too, there is a study from the Canadian Labour Congress that 70% of workers, and when they looked at this 70%, what was really, I don't want to say interesting, but really eye-opening was that, and especially to Sheena's point about intersectionality, that this was not necessarily always directed towards based upon gender or gender identity, that those individuals who identified as male also too experience, which really speaks to this vast array of who is impacted by harassment in the workplace, and that this is a concern that really we need to be taking more seriously. And so when we actually take a look at the actual legal requirements that the government of Nova Scotia has put out, that this is to really think of this as a living system, not a static policy, that prevention lives in culture, not in binders. And I thought that was really interesting when their minister was speaking about prevention lives in culture, not in binders. So bottom line, and this is just a quick brief summary here, but I'll quickly go through it in a bit more detail. What employers need to do: one, have a written policy. Develop a workplace harassment prevention policy, which many people do. Tailored to the own organization, to the organization context. And have clearly defined things like harassment and outline zero tolerance. Then it also talks about implementation and review. To put the policy into active practice across all levels of the workplace, as well as to review and update the policy at least once every 3 years, and that is the bare minimum. Training, which many of us do already, but providing regular training for all employees and leaders, supervisors, and training. What they did outline was that what training should include. Training should include recognizing harassment, reporting processes, and responsibilities. So very clear. When we look at jurisdictions all across, both Canada, the US, the UK, and EU, this is really interesting how far they went in terms of prescribing what needed to be trained. When it came to the complaint process and investigations, establishing clear procedures for filing complaints, investigate every complaint promptly, fairly, and confidentially. And then really, really clearly spelled out corrective and preventative actions. What I mean by that is taking appropriate disciplinary or corrective measures against individuals found engaging in harassment, and implement preventative actions to avoid reoccurrence. And then in terms of protection of confidentiality, again, leveled up versus some other jurisdictions in terms of protecting employees from retaliation when they report harassment, and also very clear safeguarding the confidentiality of complaints and investigations. And the policy content should include things like a statement or commitment to a respectful harassment-free workplace, which, many of us have, steps for reporting and investigating harassments, the roles and responsibilities to training awareness. But all employers must take all reasonably protective measures to protect employees from harassment, not just respond to harassment, but to protect from harassment. And this is really part of that broader duty to provide a safe and healthy workplace. And so really taking this, it's been around for, this is not net new for many organizations, but now really taking the expectation to another level, moving away from just reactive to more preventative. And what I'd love to do, and I'm going to pass the baton back to Sheena, because I would love to talk a little bit more about, some specific policy failures versus some success stories, if that's okay.
Yeah, absolutely. I'll ask you to click through the animation here. When we think about failing programs, and you likely, I think when we asked you in the poll, how effective do you think your program is already? We saw some fair, maybe it's working, maybe it exists, but we know what a failing or a less effective program looks like. Less effective programs focus only on compliance. So you're doing the legislative requirements, you have a policy in place, that bare minimum that we're talking about that is less likely to be effective in preventing harassment in your workplace. Less effective programs or failing programs tend to have no training follow up. So, usually, organizations that I've worked at or worked with have a policy in place. Maybe it's in your handbook. Maybe you read it when you onboard, you check off that you read that policy, but there's no follow up. Sometimes those things just kind of exist in the background, but without follow up, without training, without understanding of it, it's less likely to be effective. It's more likely to fail. Failing programs also usually include a fear of retaliation. So if somebody is experiencing harassment at work, they might be afraid that bringing it up, reporting it, whether it's to a leader or whether it's engaging in an active mechanism, might come back to bite them, so to speak, or might have an effect on their employment, on their promotion or advancement opportunities, or even have an effect on kind of their social reality in the workplace, the way that others will perceive them. We also know that failing programs tend to only have responsibility living within the HR space. And a lot of programs do exist. Our processes are owned by HR, but when that lives only within the HR space, there is less accountability and it is less likely to succeed. Let's talk a little bit about what success stories look like, right? Effective programs. We know that effective programs focus on prevention, and that's what we're really talking about today. Harassment exists in workplaces. It's almost impossible to eradicate it entirely. It's human behavior. Sometimes it happens. But effective programs focus on preventing harassment before it occurs, understanding what it looks like, understanding how to identify it, and understanding what are acceptable behaviors in the workplace. Effective programs also have continuous education as an aspect. So, not just a policy that lives on your drive, that lives on your intranet, but a policy that is lived out through people. How do you understand it? How do you enact it? How do you engage with it? And how do you remind people that this policy exists for a good reason and that people can engage with it all the time if they need to? Effective programs also include trust-based reporting. So moving away from that fear of retaliation, creating a sense of psychological safety, creating a sense of trust where people feel, hey, if something has happened to me, if I've seen, experienced, witnessed something, I can bring it forward and know that it's going to be dealt with, that there is a process and I will understand how that is dealt with. Effective programs also have shared leadership accountability. So it does not just live with HR. We know, and I know in my work as well, that leaders really set the tone for an organization. They set the culture, they have to walk the talk, so to speak. So effective harassment prevention, harassment addressing programs really have leaders being accountable for how it is put in place and how those values are lived out on a day-to-day basis in a workplace. I wanted to talk to you a little bit about a story. So, in real life, what does an example look like of when organizations shift from policy compliance to a prevention culture, especially in workplace culture? So, this story is about the Canadian Olympic Committee, the COC. In 2015, their president resigned. I don't know if you're paying attention to the news in 2015 or you're aware of it. This is highly publicized because of multiple allegations of sexual harassment within the COC. And even though they had a harassment policy in place, the internal culture allowed inappropriate behavior to go unchecked. So they had it on paper. Of course, they were compliant, but there was a culture of silence under this former president, the leader who was accountable for this. There were no trusted reporting mechanisms. So people had an opportunity to report, but they did not believe in it. They did not trust in it. And the leadership did not model respectful behavior. There was an unclear accountability level there. In short, right, the policy existed on paper, but there was no real prevention culture. There was no training, there was no reinforcement of respectful conduct. It was just kind of expected that everybody would go along with it. However, the COC made amends. This was so highly publicized, and they really did commit to changing their culture in the workplace. And one of the ways that they did this was following the scandal. They took some significant steps. So they launched an independent investigation and they adopted all of the recommendations from this independent review, including mandatory training for staff and executives. And as well, they included or added multiple safe reporting options. So different avenues, depending on people's levels of comfort, levels of safety, including an independent ethics commissioner. And they also held leadership accountable for holding or upholding, excuse me, this respectful culture. The key takeaway here is that policy alone is not enough, right? The Canadian Olympic Committee is a huge organization and they had those policies in place. They were there on paper, and yet harassment happened to a point where they had to address it and they had to address it publicly. What changed the game, so to speak, for them, or what changed their culture was trust building, was addressing it. They had consistent training afterwards. They had a visible sense of leadership commitment. And that's what really moves an organization from risk to resilience. I think this case is a really great reminder as well that there are metrics that you can look at, right? If you have a system in place already to address harassment and discrimination, you should take a look at the number of complaints that are coming in. An absence of complaints doesn't mean that there is an absence of
Yeah.
harassment. It just might mean that employees don't feel safe to speak up. So if you have those numbers, take a look at those numbers. If those numbers are low, that might not mean that harassment is not happening. That might mean that people don't feel safe to speak up.
That is such an excellent point. And what I'd love to do now, sorry, I gave you the thumbs up, but I realize that that's I should maybe give, but I just have to share. I've learned with this, there's other things that you can there we go, rockets. What I'd love to do is if you get your live polling out, so whether it's your phone or you can open a new tab on your computer and go to pollyv.com/Mateo. I'm going to do what's what we call like a red flag audit. And these are just some very simple questions that will take you through. You don't have to, share with the folks in this webinar where you might be landing, but really for your own self-reflection on your own organization. And we're going to ask some very pointed questions that can really help identify whether or not there could be some more potential work for your organization, especially when it comes to, not only having a harassment policy, but creating that culture of prevention and not just, basic compliance. So the first question, do all employees know how to report harassment confidentially? Again, if you need the QR code, it's in the upper right-hand corner or pollyv.com/Mateo. That link is up at the upper left-hand corner. And so what I'm seeing, and again, I don't know how many people have responded, but, it's probably not everyone. But of those who responded, 88%, we've got a little bit 11% saying that they think so. And it's interesting too, right? And this is one of these questions, often when we sit down with folks, I'll ask, do you know how to report harassment confidentially? And it's interesting that often, the response I'll get is no, even though they might have taken the training, because there hasn't been that constant reflection or that constant, being part of the culture, stuff like that, if it sits in a binder, can very much either get forgotten or it's not becoming top of mind for folks. Another question I like to ask is your harassment policy reviewed regularly and linked to metrics? And I see some responses coming in, so I'll just show some of the responses. And I'm seeing some folks saying no, some folks saying maybe. Of course, as soon as people say maybe, I'm like, is it? And some folks are saying yes, right? And this isn't to guilt, shame, or blame, but more just for that own, self-organizational reflection. Is it reviewed regularly, the policy? And is it linked to metrics? Are you measuring the right things to really understand is this effective? Not just counting how many, to Sheena's point, how many harassment complaints have come in, but are people feeling comfortable enough, psychologically safe enough to be able to say, hey, that's not right, and I need to be able to have a discussion about it or report it. Okay, we'll do another one. My last one. Do leaders receive training in trauma-informed response? Now, trauma-informed response for some might be net new, for others it might not be. And I'm seeing some responses coming in. But training in trauma-informed response really equips your leaders, equips your professionals, your HR teams, all of your teams and employees to really recognize and appropriately respond to individuals who may have experienced significant trauma, including harassment, discrimination, or workplace violence, without causing further harm. Instead of asking something like "What's wrong with you?" A trauma-informed approach could be "What happened to you, and how can we support you?" This type of training and this mindset, this trauma-informed lens approach, really shifts that culture from compliance and blame to compassion and accountability, and essential for effective harassment prevention and response. And so thank you. Yeah. And some, yeah. And so that's why, and I think one of the things that, was mentioned earlier, Sheena mentioned is, when you take a look at, in particular around the requirements and the Nova Scotia requirements, is that it's ongoing training. It's not like a once and done, you sign off on it and you're done, is really being more specific about that training. So thank you. Cheers. So what I would like to do now, and thank you folks for taking this anonymous, red flag out. Very simple, just three simple questions. Again, I'm going to pass the baton back to Sheena to really take us through this 90-day implementation playbook that we've created together, we've co-created, to really help organizations like yourselves go, okay, so what can we do now? And how do we do that? And we've broken it down into a very simple 90-day program for you.
Absolutely. Thanks, Mateo. And thanks for your comments in the chat, Kit, especially kind of from that other perspective of, yeah, maybe these things are available, but do people actually uptake it? Do they kind of learn from the training and how do they apply it? It's really important. So I wanted to walk you through this 90-day implementation playbook. After this, you'll be receiving a toolkit, which includes a lot of information on how to apply it. Understanding that for so many of you who are attending already, there is likely an existing mechanism, an existing policy, an existing approach to preventing or addressing harassment in your workplace. But we really encourage you to think about maybe revisiting it and trying to turn policy compliance into prevention and action. We do work in really fast-paced workplaces for sure. So the goal isn't to do everything at once, which is why we've kind of spread it out into 90 days. It's to move intentionally from awareness to accountability over the course of a few months. And if you need to stretch it out a little bit longer because of resourcing, do that. But this is a framework that hopefully can help you. So let's click through Mateo and talk about it. Phase one, the first month, day 1 to 30, it's really a reality check. This is the assessment phase or the assessment focus. We're going to ask you all to review your current policies against existing legislative framework. So whether you're in Nova Scotia, the new legal requirements or whatever region you're in, federally, regionally, provincially, state-wise, to check your policy against those legal requirements. And then start to potentially gather anonymous feedback from your employees, from your staff, to potentially identify any barriers to reporting. Is the mechanism too complex? Does it live in a place where people kind of need a login to be able to do it? Are they expected to talk to their managers and maybe they're uncomfortable with their manager? Are there other ways to report or to have conversations about this? Start to collect some anonymous feedback. And we say anonymous because that is a safe way for people to kind of provide feedback if possible, to identify any barriers to reporting. And this phase is really about listening and learning before acting. So to create a baseline of trust and clarity that you can move forward through. And I'll ask you to think about it and maybe reflect a little bit. When was the last time that your harassment or harassment related policies was reviewed with people and not just by HR and not just by the process owner? When was the last time you brought in additional perspectives to a policy review related to harassment? And if it's not anytime soon or recently, maybe think about it. Let's move on to the next phase. Days 31 to 60, so the next month. It's about awareness and training. And this is where the culture will start to shift. So this starts by rolling out leader and employee sessions, learning training sessions, understanding sessions, and including things like the 5 Ds of bystander intervention. This is included in the toolkit. We're not going to touch on it too much right now. We're really thinking about how to pay attention to, look out for instances of harassment and discrimination. If you are a bystander, if you're not experiencing yourself, excuse me, how do you intervene in those moments? How do you stop it from happening? How do you keep an eye out for it? And then also kind of exploring things like gray areas. As I mentioned, a lot of instances of harassment are not overt. Some of them can be really covert. Some of them you might have experienced or witnessed, and you might find yourself thinking, was that harassment? It's important to explore what that looks like and how it applies to your policies as well as the root causes of harassment. What might be leading to instances of harassment and discrimination in your workplace, and how can we prevent that from happening? In this days 31 to 60 in the second month or in that range, the key here is conversation over compliance. So helping people recognize what harassment and discrimination looks like and allowing them to respond in real time, as well as kind of emphasizing inclusion in this because people experience harassment in different ways. And training as well while you're rolling out these sessions for leaders and employees, making sure that, as Matteo said, they're trauma informed, they're practical, they're scenario based. So you're not just reading off a slide deck, you're not just reading off a piece of paper, you have opportunities to maybe role play, maybe explore scenarios where this might be happening and to engage with it. That's where learning really kind of takes place. Let's move on to the next phase, days 61 to 90. So this is the third month or in that range. This is about action, implementation, and evaluation. By this point, you've kind of built up your awareness, you have the lay of the land, you are ready. Now it's time to embed your policies. And again, if these policies exist, you can absolutely use this to re-roll out, to refresh and update your policies, right? Now you're updating your policies with inclusive language, launching the reporting process or relaunching the reporting process, re-socializing the reporting processes, and communicating outcomes transparently, right? You should be tracking metrics, paying attention to those numbers, and where available, being able to communicate them back to your employees because that really goes a long way. Visibility builds trust, and trust is prevention and action. And I'll ask you to maybe reflect about this as well, right? What would help your employees at your organization believe that reporting will lead to real action? Is it instances of kind of saying without naming names or without showing details, hey, these are the kinds of or instances that were reported, and this is how we handled it, and these were the outcomes? Is it kind of fair and inclusive and accessible access to reporting mechanisms? Is it socialization and training and reminders, accessible reminders? Sometimes even like a poster in a break room can go a long way for kind of helping people understand that this is available to you. This is a tool for you, right? What would help your employees believe that reporting will lead to real action? Hope that you can think about this today as we're kind of going through this. Thanks, Matteo.
No, thank you, Sheena. Thank you so much for taking, and I have to say, it was so much fun to co-create with you the toolkit, which is available in the chat. If anyone hasn't, definitely click and download. I'll just highlight one of the areas that for me, I get probably the most excited about when we look at the literature of the effectiveness of intervention programs to drive high-performing, high-thriving, highly innovative teams. Interesting data coming out by Dr. Loretta Ross from Howard University. She also did a TED Talk called Calling In, million more views than my TED Talks. But what I love about it is she really speaks to the importance and value of bystander intervention and how that's not a once and done, because that's how, when you do want to have a true cultural shift, because the behavior that gets allowed, right? It's not just what gets said, but it's what doesn't get said, or the lack of accountability when those undesirable behaviors, and I purposely did not talk about the COC because, for those who know me, I worked on several Olympic and Paralympic games now, and have worked with Hockey Canada. So of course, both organizations having a history of, unfortunately, lack of accountability when it came to addressing undesirable or let's call it not undesirable, harmful behaviors to folks that had less positional power in those organizations. What they lacked also was bystander intervention. being able to have effective ways to maybe manage and mitigate. So it becomes normalized and socialized. So when you call out, disrespectful behavior, to wherever it might be on a scale of severity, that it's not net new, that this is actually something that becomes encouraged, and it's not a hand slap, but is an opportunity from a growth mindset perspective to really grow as an individual and grow as a team and grow as an organization. Anyway, if anyone's interested in that, I highly recommend. In fact, she just came out with a book, Dr. Loretta Ross, called Calling In. And because oftentimes we've called out, you know, harassment or behavior that was undesirable or harmful in the workplace, and not done so in the most effective way. So her research is really fascinating if anyone is interested. But bystander intervention was probably the one that warmed my heart the most, because when I work with organizations, I don't know about your, Sheena, your experience, but often that is the part that gets missed. Is how do
Yeah,
we even just have a
absolutely.
conversation about this without it being a guilt, shame, or blame? And do people have the confidence to be a bystander, to call out these behaviors or call in these behaviors? And do the
Mm.
people who are doing these behaviors, do they have the training to then receive that feedback and not yeah, but it, and not
Yeah.
push back, but to actually acknowledge, improve, and move forward with the changed behavior, because that's what we're talking about. We're talking about there's behaviors that just have no place in our workplace, and yet they've unfortunately been accepted, because we haven't had effective ways to address. And so I really love this, understanding the root causes, understanding gray areas, and of course, bystander intervention, which is so critical. So my apology, I went on a bit of a thing, but I want to share a case study before we get to the questions coming in the Q&A. This is another case study, and it's from my realm, if you say industry, if you will, and I guess from my end of the continent as well, but Vancouver Coastal Health brought in a respectful workplace program. I just want to talk a little bit about that. For those that might not be familiar, this was a healthcare organization. It's one of BC's largest regional health authorities, over 18,000 staff, with hospitals, clinics, and community health sites all across along the coast of British Columbia. Their challenge, or what they were challenged with, was this. They identified that they were having increasing reports of workplace conflict, bullying, harassment. I mean, very common. As someone who's, grew up and worked in healthcare the majority of my life. I mean, we see this, but this is also not agnostic just to health. This is any industry experiences this, but especially in high pressure clinical environments. It's something unfortunately we still see today in 2025. Traditional HR-led investigations were very much reactive, time-consuming, and often left both the individual the complainant, and the respondents feeling unheard. So, the internal reviews also found that the employees lacked confidence in the reporting systems. Something, Sheena's was talking about is if people don't respond a report, doesn't mean that there's a lack of, behaviors that shouldn't be happening, or it doesn't mean that's not happening. It just means people don't even feel comfortable, don't have that psychological safety to even report. And many issues escalated from formal complaints. What we found was that those that went to formal complaints, if we could have had resolution a lot earlier, had we had set the table for open and respectful dialogue, and had we had set the table for people to be able to have bystander intervention and to be able to respond if you are the individual who's engaged in that behavior, who maybe didn't realize that their behavior was harassment, because we haven't really talked about it. We haven't normalized and socialized talking about this. And that the psychological safety in the workplace culture ultimately was suffering, contributing to even further burnout and turnover. So I'll just quickly take you through some of the things that were done. But what's interesting is this program really became a benchmark across BC's health sector, inspiring similar models in other regional authorities. So the response was the Respectful Workplace Program, launched as very much a collaborative, trauma-informed prevention system. The initiative aimed to resolve conflict before it escalated. And that was where the focus was on, to really strengthen workplace culture through education, accountability, and timely intervention. And as well, the leaders at Coastal Health reported, team cohesion, retention, and psychological safety indicators in those follow-up assessments. So some of the key components I just wanted to highlight for us, just quick summary, that they had an early resolution model. Encourage staff to address conflict informally with advisors. So someone who could walk you through just how to before filing that formal complaint, someone who could walk you through it. Advisors were trained in trauma-informed listening, mediation, and cultural sensitivity. Because what makes sense for, for those in a visual descriptor, an older cisgendered white male with a shaved head and a big beard and tats might be different for someone with different intersectional identities. And so that's important too to take note of. Dedicated, respectful workplace office. So the RWO is what they called it, but this was a centralized hub, independent of HR, ensuring confidentiality, timeliness, and psychological safety. So they made those the three pillars of this dedicated, respectful workplace office. So other things that happened was, again, we've talked about this a lot, was comprehensive training and awareness. So mandatory education on respectful conduct, equity, and bystander intervention, plus the leadership workshops on conflict, bias, and trauma-informed response. And then, of course, something that, very near and dear to our heart here at Diversio, but data and accountability. So it's one thing to track the data, but then also to have that accountability. So, they having the reporting on resolution outcomes, ongoing policy reviews, integration of employee feedback to drive continuous improvement. It was interesting as well when they looked at the data reporting. This wasn't just, the head of HRs on their dashboard. This was a dashboard for all executives to have. And that was really key. So, takeaways for me really was prevention through early intervention, trauma-informed responses to help rebuild that trust, and being very clear and transparent communication. So regular ongoing communication about outcomes to help build that credibility and accountability. And so really sort of interesting. I'm seeing some questions coming in. And so I'm getting old, so I have to take my glasses off to read what's on the screen. So while we do this, and Sheena, let's do this. Maybe we can do this together. So I have a
Yeah,
question here
absolutely.
in the chat. What
Yeah.
options are available for HR employees considering that they are the contacting group to solve issues of that kind, but they're also employees who may experience, yeah, and that's, if I'm reading this correctly, you have employees in HR who are typically the ones that you go to, and then who might then also be part of, might be experiencing, harassment as well. Where do they go to, right? And that's a really excellent point. And I've seen, Sheena, I'll defer to your great
Yeah.
wisdom here. But one of the things I've seen is again having that anonymous way, and then also having independent ways, so it becomes outside of HR as well. And some third party, I've seen some organizations, some large organizations use third party providers for this. Others have, launched independent investigations. Well, there is a plethora of ways, but that's a really interesting point that when you are building out these systems, what about, taking a trauma-informed lens for the folks that are at the forefront? So if I use an emergency room analogy, yes, you have, your admitting clerk and your triage nurse, but you also have to make sure that you're also providing triage and care for the admitting clerks and the triage nurses as well. Otherwise, you're going to burn through them way too quickly. And they're so critical to the operations of that organization. So I don't know if that analogy worked, but anything else, Sheena, that you'd like to add?
I think you made some really excellent points, Mateo. I would have said the exact same thing. I know that, especially like dependent on the size and the resources of your organization, a lot of the time responding to harassment complaints or the policies and processes around it live in HR. And many of you, I imagine, maybe some of you are HR professionals who are attending here today. And you know the amount of pressure that is put on you to be able to kind of resolve
Yes.
and address these things effectively. I always encourage to take care. If there is a way in your organization, as Mateo said, to adopt a trauma-informed lens, to allow for anonymous reporting, to put this, to outsource this to an independent reporting system or an independent review or an independent ethics commissioner, something like that, then please take those avenues, take those opportunities, because it can lessen the burden on you as HR professionals as well. Thank you so much for your question, Yvonne.
Cheers. And I see we got three questions right now in the Q&A, and I think we've got some time. Let's try, maybe we'll go in order in
Let's
which
do
they
it.
came through. So the first question, and thank you, Emmy, for if I pronounce that correctly. Can you elaborate on how you frame the, sorry, I have to do this. Can you elaborate on how you frame the metrics you're reporting back to the staff? Do you say you have X number of complaints and X number of resolutions? That's one start, but certainly not the only thing that you're going to talk about. There's, and I think Sheena talked about this earlier, that there are, questions that we can be asking and reporting back on that really reflect around the culture of accountability, the culture of psychological safety, and understanding the intersectionality of that. Because what we have certainly found here at Diversio is that often folks that might present similar to me often report very high levels of comfort in psychological safety, high levels of comfort in being able to report anonymously. But when we look at the intersectionality, when it becomes different dimensions of diversity, then maybe how I'm presenting, what we see is that number becomes drastically different and not in the way that we'd like it to be. And what that's speaking to is often we need to take more intersectionality account. And so, Adeshina, I don't know if you have anything more
Yeah, absolutely.
to add
Mateo, I'm
that.
going to
Yeah.
ask you to click through to the next slide as well. So in case
Oh,
folks have to leave,
for
then they can
sure.
kind of
Yes.
see
Cheers. Yeah.
the information on how to get in touch with us.
Yeah.
But yeah, that's a really great question. In terms of metrics that I've seen, I've worked from a consultative perspective with organizations in kind of bolstering or improving their harassment prevention or addressing mechanisms. Absolutely. X number of complaints versus X number of resolutions is a really great metric, either internally with your leaders, especially to have them aware of kind of what's going on and how you're addressing it. And if those numbers are changing, again, if you have like low incident numbers, maybe not seeing that or kind of resting on that is like, hey, our workplace is safe, but maybe delving a little bit further to see like, why are these numbers so low? Do people have access and feel comfort reporting? Training is also a metric that is really important to take into account and to talk about. So, what are the numbers of attendees in your training sessions around your harassment or prevention policies? How many folks, how many cohorts, how often are you doing it? These are really valuable metrics to keep track of when you're thinking about socializing these policies as well. And, internally, I think these can be really important to hold yourselves accountable as an organization, but potentially even externally, right? If the numbers are looking good, if you're like proud of them, if they are tracked over time as well, if you have like longitudinal data, these can be a really great way of being thought leaders in your space, whatever industry you are in, whether it's for profit, nonprofit, private sector, government, whatever, to be able to kind of talk about, hey, this is what we are doing. This is how it's working for us. Yeah, there are a number of different metrics that you can track that are not only just number of incidents versus how they're handled, but also training, also intersectional data on how comfortable people feel or how psychologically safe they feel engaging or interacting with that system. Those are some things that you can track. Thank you for your question, Emmy.
Oh, cheers. And I see another really great question. Oh, they're all excellent, but this one's really interesting. And it's also very timely because it's one of the clients I'm working with right now. But how do you address harassment that happens outside of work hours but impacts the workplace, for example, team social events? And the reason why I say this is so topical, so there's been some recent decisions both here in BC and in Ontario where, harassment had occurred at like social events, at a conference, or at like a networking event. And if and what the rulings were in all the cases where if the expectation was that they had to be there as part of their role, and there was positionality, and so the courts took into account the positionality, because often there was different positionality as well occurring. And often these events, these after hours, where alcohol is involved, positionality, inappropriate behavior, it's a moot point. And so from my understanding, I'm not a lawyer, but from my understanding from these court cases is that they will still consider that, especially when the expectation is that you're there because of your role in that organization, right? So if the expectation is you were going out for team social, to Dave and Buster's, or we're going to the bar after to watch the game, we're going to have some beers together. Business occurs there, right? Or if you're going to, an event and you're going to an event with coworkers, the law is very clear that when that behavior's occurred there, especially if it's part of your role, then it considers it no differently than if you were in the office. And so and hopefully that answers your question. My encouragement would be that your policy is clear, that it doesn't matter whether it was physically in the office or not, that disrespectful behavior or that illegal harassment behavior, or wherever it is in the severity scale, wherever it occurs, will be addressed. Because as we know, if it does happen at a team social event, that's going to impact the next day. It's going to impact the bottom line for that organization. So hopefully that uh, helps answer that question.
Yeah, I
Anything you'd
totally
like
agree
to
with you,
add? Yeah.
Mateo. Yeah, absolutely. I think that you nailed it with like, you need to be really clear in your policies that external events, especially when they are in a work-related context, the rules still apply, right? Sometimes we get those kind of gray areas. That's what we were talking about, where the lines might seem blurred. Maybe it's a very social event, right? If folks are meeting up like after work for drinks at a bar and it's not like a team event, then that's a different story. But if it is a networking event, if it is a team social gathering, the rules still apply. It is still a part of your workplace, even if you're not in the office. And this also applies virtually as well, remotely as well, right? Virtual
Yeah.
spaces, Zoom meeting rooms, team meeting rooms, that is still the workplace that you're engaging in. So please be really clear in your policy that it applies to any event kind of work related. And you can name examples as well. So people kind of know what to expect when they are participating in these activities and know that they are going to be expected to be held to the same behavioral and cultural standards.
Thank you for that. And so the last question that I'm seeing, if we operate in multiple jurisdictions or multiple provinces, do we need separate policies or can one cover everything? And again, caveat, I'm not a lawyer, so I would just want to caveat that. But when we do look at several of the decisions that have come down when there's been, organizations with multiple jurisdictions, what I have seen is that where the ruling went to is that they will hold that organization to account for either their own internal policy or whatever government regulation or mandate is there, whichever one's higher, they're going to hold you to. And so if you do happen to operate in Nova Scotia, then my understanding would be then they were holding you to account to the highest level standard. So hopefully that helps answer. Anything else, Sheena? Sorry, I have to keep taking the lead on this, and I should defer to
No,
you
no,
because you
it's
know better.
wonderful. No, I agree with you. I also am not a lawyer, but yeah, I agree with everything that you've said.
Yeah.
Absolutely. There's another question that came through in the
Oh, yeah.
chat as
There we
well.
go.
Yeah, what
Okay.
role should ERGs or employee committees play in shaping harassment policies? I know, Mateo, both you and I have done a lot of extensive
Yeah.
work with ERGs, with employee committees, with diversity committees, and things like that. I would say that they are really, really pivotal to these policies because they are employees. They're the ones kind of living and working in your workplace, and they have an eye on kind of how things are happening and
Yeah.
how people are experiencing the workplace. So what I would say is ERGs, employee committees, get them if they have the capacity within the role that they play to review these policies. Get their opinion on whether these policies are applicable, inclusive, accessible, understandable. Have them advocate for the systems in place as well. So when you're hosting training, when you're hosting learning sessions, when you're hosting discussions, potentially have them kind of sponsor, maybe say something at the beginning of one of those sessions. Have them kind of encourage socially within your workplace as champions of safe workplace culture, of the workplace culture that you're trying to build, that, hey, this is important to us. This is important to you. Let's do this together. What do you think, Mateo?
I agree. So I'm just going to add, it's interesting. I had this come up. I had a session earlier this week with a client, and they shared with me that it wasn't a harassment policy. It was a different kind of policy, and they thought it was fairly innocuous. And it was one that just the HR and the HR leads, built and rolled out. And after they had rolled it out, they got feedback from two of their ERGs, from their Indigenous and their Pride ERGs, employee resource groups, that they hadn't taken into account from an Indigenous perspective or from a to us LGBTQI plus perspective, the impact this might have on trans or two-spirit employees. And even though this wasn't anything to do with harassment, but it was interesting because the HR leader said, yes, she openly shared her team was all cisgendered straight women. Not anything wrong with that. However, that came with only one perceptional lens that couldn't be applied to understand what gaps might exist with folks from other lived experiences, other lived traumas, that it was a miss for them in that they wasn't intentional by any means to exclude, but by not having different people with different lived experiences being able just to provide input at the beginning, they could have mitigated this by having, even sharing and using the ERGs as a way to really just, does this make sense to review? But then the other eye opener was we probably should have co-created versus top down because we built it from our understanding, our viewpoint, not realizing that we could only see from so much and not be able to see everything. So I realize that we are
Yeah.
coming to our end. Any other closing comments or remarks?
Yeah, actually, hearing you talk reminded me of a client that I was working with a couple of years ago, and recognizing that employee resource groups or committees are a leadership building space. So frequently,
Yeah,
employees that engage with these spaces are looking to grow their skill set, are looking to take on leadership
yeah.
opportunities outside of their role. I worked with an organization that provided upskilling and training for some ERG and some committee members to be able to be a first point of safe contact for when harassment and discrimination issues were coming up. So they were trained, they were provided opportunities to learn from a trauma informed basis how to receive these kinds of complaints. And of course, it doesn't necessarily always escalate to engaging with a complaint mechanism, but sometimes people kind of just need somebody to talk to, somebody safe to come to. If they don't feel safe going to their manager, if they don't feel safe going to HR, there's a
Right.
potential for ERG participants or leaders to be trained and upskilled and to be provided kind of the guidance to be leaders in that space to help prevent and address and potentially care for those who are experiencing
I
harassment.
love it. So instead of just using the ERG as glorified event planners, how can we use the ERG or that committee or whatever it is as a way to develop the next generation of leaders, to develop those leadership skills that are so critical? And then you've got an internal pipeline to be able to promote from
Exactly.
versus trying to always hire them out. Anyway, I love it. Thank you everyone for this. But definitely, I'd love to continue the conversation. Information here, our email. I'd love to continue the conversation, but wishing everyone all the best. Big cheers and thank you so much.